morning, all of you, and two chairpersons, Chancellor Dr. Nihal Silva and CEO Dr. Gitsiri, and all the nursing principals and the director nursing, and ladies and gentlemen, and all IHS colleagues. So my topic is something little kind of different aspect. This is how nurses can really use their knowledge and their opportunities for the nutrition promotion. So in that sense, first of all, I was really looking at nurses are really having a unique position to provide the nutritional promotional kind of setting and giving the nutritional promotional things for the patients, because you are always with patients, especially even when we take it from the inward. Now, you are providing the diagnosis card for each and every patient. So that's another one opportunity you have to give a promotional thing. So at the same time in the OPD, you come across each and every patient come to the OPD, because even the registry or something and so that's another time that you have an opportunity to provide the promotion. So at the same time that your words carry lot, because nursing profession has a lot of kind of influence to the patients, because they listen to you, they know, they talk to you. The patient likes to discuss their outcomes with you. So because that's a closest friend in the hospital is nurse for the patient. And at the same time, especially there are some nurse-led nutrition promotion program. Even Sri Lanka, I know these nurse diabetes educators became, and they were also doing a lot of programs. So when we look at in the world, there are so many nurse-led promotional programs are there, especially to prevent these chronic diseases like obesity, hypertension, strokes, and all cardiovascular diseases. This is some of the strategies, evidence-based strategies, which has been really come up the things. One of the thing is you can really educate the patients. The one is patient education and counseling. This is very much important. Sometimes you really look at the patient and the patient asks, how am I going to take the drugs? All these things they come and ask from you. So that's a kind of patient education as well as counseling part also. So you can always talk to educate the patients on this balanced diets, portion controls, and the healthy food choices and all these things. At the same time, you can really engage with the patients with the communication, some techniques. And another thing is behavior change techniques. At the same time, you can always promote the patients to get the healthy habits at their goal settings. At the same time, some motivational interviewing, because this is very important. If someone is having the higher weight, it's very difficult if you are not going with the motivational interviewing. Who has time? I mean, the nursing profession is the one that who are more engaged with patients, and you have more kind of closer to the patient. And then the community engagement. At the same time, some of you in the community, and then there are so many community programs, and currently mainly our community sisters, and they mainly cater on the maternal and child health, but there are some other aspects beyond that. And the other thing is use of technology, because nowadays you don't need to do all these posters, leaflets and everything. There are so many digital things like tools, apps, and everything are there to communicate with and tracking, especially tracking and then the education part. So there are some, I'm really going to show you some case studies and examples, how these nurse-led programs are going on and the successful programs. I know Ruth and them, they have been really using nurses, and the Nishan is there. They are using all these nurses in Australia very well for this type of promotional things. And especially those things they have shown in these programs, there are a lot of improved patient health, and even the healthcare cost has reduced because of that. As well as individual patients have really got their they have got benefited all these things. So I am just starting from the one thing, that is a diabetes prevention program. So you know, in Sri Lanka currently 20% of our adult population has diabetes, and 30% are pre-diabetes. So it's a huge problem in Sri Lanka. So this is something coming from, I just showing you one article, but there are so many articles and about how these successful programs that which are led by nurses with the diabetes prevention. And here the nurses can really provide the major role for the education and the counseling, as well as they can support the participants. And at the same time, these programs, they have kind of focus on the weight loss and healthy eating, as well as increased physical activity. These are the three key things they have kind of catered. And then with the results, it has shown that there's a significant reduction of the diabetes in the population, as well as this highly effectiveness of this nurse-led education programs. So just see some of the few things. I thought I should really show some little things that you can do. Now this is, all of us know, this is how we digest our food. When we eat, all of us digest in the same way. So what will happen in the diabetes? And because with the kind of this whole thing that our pancreas has to work, our insulin has to come up, and then the glucose has to be taken to the cells, all this process should go if we want to prevent this diabetes. So in that sense, so this is what happened in the diabetes. Because body lacks insulin or body is unable to produce insulin effectively. So this is a very simple mechanism when we look at the basic principle of it. So then this is what people have to know about it, because you know some of the diabetes people, they think we don't need drugs. We can just stay like that. So at the end of that, they ended up with the CKD and they ended up with some other complications, because this is what happening in the diabetes. And then these are the simple things the nurses can, I mean like a nursing profession can give. So these are the simple things you can give it to the patients. All these research has found. Eat same time every day to control your sugar level effectively. This is something very simple. Because if we take the eat same time, the breakfast, lunch, dinner, try to eat at the same time. At the same time taking snacks. Sri Lankans are very kind of famous to take a lot of snacks. But take some healthy snacks. This is the important message. Not to take all unhealthy snacks, take some healthy snacks. So that's a very simple message you can give it to in the promotional part. And the second one is, what is this diabetes diet? There's nothing called diabetic diet. It is kind of consistent carbohydrate diet. You have to eat the carbohydrate consistently in your diet. So that's we have to first think about what are the food groups which has carbohydrate. So there are some food groups, all these things, cereals, pulses, fruit, milk and sugar. All these things have carbohydrate. So we have to really look at, rather than adding all these things together in one meal, just spread out in your whole day, and this is what you call consistent carbohydrate diet. So any diabetic person can eat anything, even ice cream. But there is a way of eating it. This is what important. When you get sick, people don't like to say that you can't eat that. That's the worst thing people will hear when you get sick. There should be a choice. I mean, they can eat anything, but there is a way of eating. This is what in the promotional activities, actually, you can really tell the people. And then the periodic adjustment. So these are the very simple things in the promotional programs which has really done. And the other thing is, this is something actually coming from my book. And there are so many things are there in our fruits and the things, how much you have to consume. This is important. Then whenever you don't know about how much of carbohydrate, you don't need to memorize those things. This is what these picture arts and the atlas and things are there. You can just show the people. So now see, one roti is equal to half a cup of kind of rice, or with how much of how many sweet potatoes, how many manioc. So that means people can eat anything, but they have to know the quantity what they are going to consume. This is important. And the fruits. People say, no, if I am diabetes, I can't eat all the fruits. Anyone can eat any fruit, but the quantity is the most thing important. And then if you are eating the mango, you have to eat only half small mango. So that's a kind of thing. That means you can eat anything. So this is what important in the nutrition promotion part. These are the things we have to really convince for the people. And it's the same way, and this is okay. So this is another thing, sugar. So sugar is kind of now some people they have diabetes but they want to eat the vatalappan during their Ramzan period. So that's obvious. So how can you eat Ramzan, your vatalappan? So this is what even the each and every sugary food, how can we consume and how much of sugar is going to our body. This is just a learning thing. These are the things in the promotional part. We have to really learn, and then you have to really tell your patients. These are very simple things to kind of thing. And then finally that how do you ideally your main meal to minimize your sugar load. This is what important. And then to minimize it, this is the way we say the vegetable protein. You can see the way you have to eat your rice plate. And when you minimize, I mean, it does not mean that you can't eat rice. You can eat rice, but you have to really control your sugar load. So next program I am going to highlight is a cardiac rehabilitation program. This is another one of the very successful programs which is led by nurses. Even Sri Lanka, I know cardiology unit, they are running it in the very good manner, and most of the nurses are promoted, kind of leading it. They are also mainly, especially looking at the heart healthy diet, as well as nurses has provided educational and the monitored patients' progress, as well as they encourage the adherence to the lifestyle changes. So finally, these results demonstrated there is an improved cholesterol level, blood pressure, and the reduced hospital admissions rates, as well as finally there's a big impact with this nurse-led improvement. So these are the few kind of one of the abstracts. So in that, what we can really emphasize, belly fat. I think this is something you can really put it into a promotional part, because we know that everybody has some sort of tummy, and then especially that which is go to the visceral level and the omentum level, and this is a problem, and then it will go surrounding with the liver. You know, each and every patient when come to you, you must have obviously seen that they have a fatty liver. Now 50% of our adult patient has fatty liver. That because of this belly fat which is deposited around the liver. And at the same time then our tummy will become hard and harder because the fat is going to store in the omentum. This is Sri Lankan situation. You can see that how scary. Our centrally obese, about 1/3 of our adult population has kind of central obesity. Because why this is important? The next one is how do we detect it? This is we measure our waist when we go to our tailor. But this is little different than that. You have to measure it around your umbilicus, and then you can see that if it is more than 90 for male and more than 80 for female, we consider it as an alarming situation. You have to reduce it. That's a level. And then why we are very concerned about this visceral fat? Because there are so many research which has really linked to this visceral fat, that is cardiovascular disease, and especially when you reduce 2 inch, you can reduce 10% of your cardiovascular diseases. So these are the kind of rehabilitation programs they were emphasizing. And then at the same time with this visceral fat, you can get the blood pressure, blood sugar, all these levels are really kind of correlated with that. And especially metabolic syndrome, you know, Sri Lanka, how much we are having these metabolic issues. And then the next one is dementia. So this is another thing which is coming up in Sri Lanka, because we never had this issue earlier. Our grandparents, they live even up to 90, 100 years even, they were very sound with their memory, but now dementia is the issue. So even the dementia, they say it is 3 times more likely to develop dementia in this type of, with the people who are having the belly fat. And the other thing is, especially the asthma, breast cancer, colorectal cancer. You know, as nursing professional, how many people are coming with colorectal cancers in Sri Lanka. And the breast cancer, this has also become very common. So all these things, actually, we can control with this type of programs. And the other thing is, how do you get rid of this how do you get this visceral fat? You know, there are so many things, and your birth weight, so many things are involved with that. Our genes, we are very prone, and with our age, especially with the menopausal age, and all these factors will come into the things. So this is one of the common things in Sri Lanka. So the high fat. We eat a lot of high fat without our knowledge, because this type of food, they add a lot of reuse oil, reuse things, and a lot of oil, but for the taste preference, we like this type of food. So these are the some of the culprits for this our problem. And the other thing is, the next one is, the good news is, we can really control it. And this is what these nurse-led programs have shown, and especially with the diet and exercise, these are very important. And one of the things we always say, keep moving. Now actually people say to reduce the belly fat, you have to do the brisk walk. Brisk walk is something like, you have to have 6 kilometers per hour. This is what you call brisk walk. Not like just, the people say that we are working, we are very tired, we do a lot of work, but it does not count for the brisk walk. And otherwise steps wise, it should be 10,000 steps, not the 6,000 steps. And the other thing is, especially resistant exercises. These are very much important, and especially after some age, you have to maintain your muscles. So therefore the resistant exercises are very important. So these are the things these nurse-led programs, they have done. And then this is a kind of thing, you can always give the weight goal for people. No one can reduce your weight for the teenager level. That will never happen. So you have to really do the things to do it slowly, and especially goal should be 0.5 to 1 kilogram per week, not more than that. And then you have to do it very slowly. And this is something whenever you can always use. How can you reduce 500 kilocalories from your diet? This is, you can see, all these things, rice, sugar, your pizzas, colas, and the fish bun, and all these things, how much of, and especially this chocolate biscuit, how much of the calories are there. So you have to get rid of one food item from your diet. This is very easy. And the other thing is, as a result, you can see, at the same way, you can reduce about 2.4 kilogram per month without any problem. These are not very hard things. And the other thing is the portion sizes. This is another thing, always nurse-led programs, they have been used in the US. These portions, how these portions, and because when you say the people cup and all sort of things, people can't measure and eat. It should be practical for the people. This is what these portion controls have come up. And how much of vegetable, how much of rice, how much of meat, and the fruits and the oil. So this is a very basic educational part which has been used by US nurses. The next one I am just going to touch upon, I have 5 minutes more, and the pediatric obesity. In the pediatric obesity, this is another coming up problem. This is another thing, other countries have used nurse-led programs to reduce the pediatric obesity. These are some kind of papers which has been published. There they have observed this type of program actually with the nutrition education and the behavior change, and especially the overall childhood obesity has really controlled. Now these are the things why we are concerned about childhood obesity. You know, it will end up with all these issues. I mean, it is something very alarming when we see childhood obesity in a country. So now in Sri Lanka, you know, it is going up every day. And what is the issue? Sugar, fat, and salt. So these are the things kids like. So the parents have to really buy and give it to them. So these are the foods they want to eat. And then what parents have to do, you can't every time tell your kid, no, you can't. You can't eat. That won't happen. So the thing is, that's what the labels are there. You have to see how these labels and the this how much of carbohydrate and the things when you are buying these packeted food items. And then the color traffic light labels, you have to look at this traffic light label, whether red, yellow and things. And then why these things are there. You should not buy these things every day. You should not buy these things, red one. You should buy only occasionally. So this is the reason these traffic light labels are there. So then the child is also satisfied because he is getting it at least once a month, but not every day. Other thing is a healthy fat. Kids has to be given this healthy fat from the beginning, because all the healthy fats items are sesame, avocado, small fish, those things are not consumed by kids. So we have to see how to promote it. And the egg is another healthy fat, and the less deep fried food. And the kids, they love deep fried food. How do we really change the behavior of the kids? But we should not say no to kids, because it never, you can't go do any programs when you say no. Then the next one, I just want to, the community-based nurse-led programs. As Ruth has mentioned, there are so many primary care nursing-led dietary interventions have very successful programs. With that, they have successfully increased the fruit and vegetable consumption and reduced the fast food intakes, as well as overall dietary habits were improved with this type of programs. So these are finally the obtaining the right nutrition. We need all these things. We can't really have the no rice, no that is no, there's nothing. But you have to eat all these food groups. I'm not going to really tell you one by one. And all these food groups should be there for our everyday meal if we want to have a right nutrition. Because all the things we are not eating only to reduce our weight or increase our weight. We are eating to promote our health and reduce our diseases also. This is the important thing. And the other thing is nutrition promotional in the primary care. This is another aspect which has been really developed in UK. I know in the Health Education Authority, they have been really doing this in the personalized nutrition counseling by nurses, as well as they provide this managing the chronic conditions and they increase the patient satisfaction with the healthcare services. And so this is what they mainly focus. Healthy eating, we have to see it is not a strict diet plan. It is not skipping meals. It is not avoiding snacks and treats completely. It is not a fat-free diet. It is not a low-carb diet. It is not an extremely high-protein diet. It is not even about counting calories all the time. We have to follow the eating plan. So it is the thing we have to talk it as a healthy eating. So this is just making shifting, and you have to see that if you are adding the sugar, we have to now add the minimum sugar. You can't just avoid 100%. This is the shifting. And the fruits with sugar, we have to now get just a fruit. And the fried vegetable, make into the roasted vegetable. And the high sodium snacks, like that, you have to shift. You have to make a shift, not the drastic change. So all these programs, they have a lot of barriers and challenges, because these are the time constraints with other duties, as well as lack of resources and the specific knowledge. So this is what important in the promotion. You need the specific knowledge to educate the people. You need the specific knowledge. And then this is what the training are needed, and the collaborations are needed, and the technologies, using the technology is important. So the collaboration is very important. With all the healthcare professionals, we have to collaborate, and the interdisciplinary teams we have to create, and especially for the nutritional promotional plans. And the role of nurses are very important to identify in this coordinating care and the connecting with patients. In the future directions, actually, if we look at, we have to really see these emerging trends in health nutrition promotion, especially with the personalized nutrition and the precision medicines. And then the nurses have a high potential to as well as a larger role in the primary health care as leaders in the health promotion. At the same time, we have to promote some research and produce some evidence-based practices in the nutrition promotion. So with that, thank you very much for all your kind listening.